My reflection for eHealth 724: Fundamentals of the eHealth and the Canadian Healthcare System. It has been over a year of reflection, where I've had the opportunity to reevaluate the importance of eHealth to me and my future career goals during my second eHealth application round, and now being in the program. Having finished my first term, my definition of eHealth is constantly evolving the more I learn about its importance and influence to healthcare delivery. So why eHealth? What influenced my decision to pursue eHealth was the thought that I could be a change maker in the field of healthcare, with the definition of eHealth as a sector that implements the use of technology to create accessible healthcare. My professional experiences as an instructional assistant and e-learning coordinator with McMaster's Faculty of Health Sciences further solidified my commitment to equitable healthcare, where I was able to develop a course for healthcare providers to reflect on anti-Black racism in science, healthcare, and the medical field. Here, I analyzed user data to assess learning outcomes and improve course content, a skill applicable to eHealth in analyzing patient data to refine health interventions and personalized care. My role as an academic support associate and student services representative with the Faculty of Sciences has allowed me to guide students on programs, admissions, and financials, paralleling the support and accessibility goals within eHealth to improve healthcare literacy and access to resources. I have supervised teams highlighting leadership and project management skills necessary for managing eHealth initiatives that require collaboration among healthcare professionals. Looking back on these experiences, both professional and academic, has highlighted my passion for leveraging education, technology, and science to create accessible healthcare solutions for marginalized communities. I am also driven to bridge the communication gap between clinical professionals and technical experts, promoting patient-centered care and digital health innovations. My commitment to advancing healthcare equity through the integration of evidence-based policies, community engagement, and data-driven decision-making ultimately led me to wanting to pursue a career that combines all of these factors, which is one in eHealth. Throughout the duration of this course, it has been solidified to me that the healthcare industry offers much more than meets the eye, as collaborative learning is the backbone in many of the medical advances such as eHealth. The value of healthcare analytics in eHealth continues to be emphasized, as the collection, analysis, and interpretation of complex healthcare data creates insights that drive critical decisions and assist hospitals and healthcare workers to provide better qualities of patient care. As someone who is keen on using my passion for healthcare literacy and leveraging it with digital tools to create accessible healthcare with a focus on marginalized communities, getting to know how complex the Canadian healthcare system is, including its funding and structure, has highlighted how there are significant gaps in healthcare accessibility that eHealth solutions attempt to address. For example, telemedicine platforms, a key component of virtual care discussed in class, bridge geographical barriers for patients in rural areas. However, accessibility is not universal. I learned from the textbook Health Systems in Transition, Canada, that disparities still exist due to digital literacy and uneven broadband infrastructure. This realization has shifted my understanding of eHealth from being merely a technological solution to one that requires a broader consideration of social inequities. When it comes to interoperability, a word that was introduced to me during this course, I saw how integral creating a connected healthcare system was, while emphasizing the importance of policies that prioritize security so that the storage and exchange of healthcare information across systems is seamless, creating trust between providers and patients, while ensuring an effective continuity in care. For example, the integration of data from different sources, such as lab results, pharmacy records, and patient histories, The role of policy and legislation also tie into this, where PIPA in Ontario plays a pivotal role in regulating the use of health data, which is something that I was not aware of previously. It was interesting to learn more of how, although these laws promote the promise of patient confidentiality, many patients lack trust as data breaches continue to arise. This dual role of policy as both protector and potential obstacle was an eye-opening revelation. The importance of efficient EMR and EHR use became apparent as we progressed week by week throughout the course. I can reflect to a personal experience of mine that occurred more recently. A relative struggled with managing multiple medications after being discharged from the hospital. If an EHR system was integrated medication management had been in place, their care providers could have ensured their coordination and avoided errors. Learning about these systems in class made me reflect on how fragmented communication in healthcare impacts patient safety and quality of care. Seeing how difficulty in use has created and continues to perpetuate operational challenges while increasing provider burnout has been eye-opening. In addition to this, initially, I had minimal awareness of stakeholder complexities or equity challenges, and I underestimated how many stakeholders are involved in e-health solution implementation. Through class discussions and readings, I realized that stakeholders include not just healthcare providers and patients, but also IT professionals, policymakers, insurers, and data security experts. For instance, the adoption of EHR systems requires coordination between developers, clinicians, and administrators to ensure usability and compliance with privacy legislation. This insight was reinforced during a guest lecture on hospital information systems, where the speaker emphasized the challenges of aligning clinical workflows with new technologies. I now understand that technological solutions are only as effective as the policies that support their implementation. As I reflect on the course, discussions of EHR implementation highlighted the need for cross-disciplinary collaboration to ensure that there is usability and security. Moving forward, I plan to stay informed on advancements in digital health and advocate for equitable access to these innovations. At the start of this course, I was intrigued by AI and also overwhelmed at the thought of it. Being introduced to AI applications in healthcare, such as clinical decision support systems, has broadened my understanding that it has the potential to transform care delivery. One example that stuck with me was one discussed in class, which was the use of AI in early detection of breast cancer through mammography analysis. This aligns with my newfound understanding from the readings within the Health Design Thinking textbook, which emphasizes designing technologies that enhance provider decision-making while being intuitive for end users. However, this also raised concerns about data biases in AI models, which could inadvertently exacerbate health disparities if not addressed. Additionally, AI's ability to process vast amounts of data quickly is transformative, but it also raises ethical questions. For instance, the use of AI in predicting patient readmissions, which could unfairly penalize those from lower income backgrounds due to biased training datasets. This learning reinforced to me that there is a need for transparency and equity in AI model development, a topic that I am interested in learning more about outside of the classroom. As someone who thrives in independent learning, the tutorials and small group discussions were shockingly my favorite part of the course. The topics were interesting to discuss, and having a safe space between like-minded and sometimes not like-minded individuals made conversations lively and brought new perspectives regarding digital health to the forefront. Working in small groups during tutorials allowed me to practice presenting complex topics such as public health informatics and e-health during my tutorial facilitation to a non-technical audience. Week by week, my confidence to participate increased as my interest and understanding of new topics grew, highlighting how this skill will be invaluable in my future career, where I may need to bridge the gap between IT developers and healthcare providers in a knowledgeable manner. The discussions also exposed me to diverse perspectives, which helped me better understand the challenges of designing inclusive e-health solutions. So what's next? It is clear to me that I want to work in a field that provides mechanisms for healthcare professionals to cope with the rapid changes within socioeconomics, technology, epidemiology, and trends within demographies. It is my goal to fill the accessibility gap by evaluating e-health trends through an EDI lens so that the data collected is diverse and representative of a whole population, therefore destigmatizing the use of technology in healthcare and emphasizing its importance in supporting the sustainability of healthcare infrastructures. My ideal future career in e-health is one that is multidisciplinary, allowing me to work with clinical professionals and technical members who do not have healthcare experience to bridge the knowledge gaps between these two groups. It is one that merges e-health and EDI, catering to patient-centered care, providing solutions for accessible healthcare and delivery. Working as a professional in the field of e-health would grant me the opportunity to implement healthcare policies that support the integration of technology in clinical systems while examining current inefficiencies and creating solutions for improvement. My goal is to use the knowledge gained in this course to provide technical expertise to clinicians, liaising with other healthcare professionals while improving patient outcomes and reducing the overall cost of healthcare delivery services. I'm excited at the thought of learning more about e-health's influence within the Canadian healthcare system, as well as its impact within my personal and future professional life. I will now explain how and why I used Canva AI for visuals in this reflection. So I utilize Canva AI to create visually appealing and customized graphics for my reflection presentation. This includes personalized images with figures that represent me and my past experiences and future in e-health. I chose Canva AI because it allowed me to save time, where the AI-generated suggestions sped up the process of creating professional-looking visuals, which otherwise would have taken much longer. It allowed me to maintain consistency, where Canva AI's pre-designed templates ensured that the graphics aligned with a cohesive theme, making the presentation more engaging and visually unified. Also, it allowed me to simplify complex concepts, where I created visuals for challenging topics such as data interoperability and AI biases, which made it easier to convey my ideas effectively. Canva AI helped as it provided ease of use, where the drag and drop interface and AI-generated recommendations made it accessible even for someone without advanced design skills. It enhanced presentation, where the visuals created through Canva AI added a professional and polished touch, which made my ideas clearer and more engaging for viewers. And lastly, it allowed for creative inspiration, where it provided design inspiration through templates and suggestions that I might not have thought of on my own. Nonetheless, there were some challenges when using Canva AI. This included generic designs. So while helpful, some AI-generated templates lack the specificity needed for certain healthcare-focused topics. I had to spend additional time customizing the visuals to align with the content of my reflection, and some features required external tools for manual edits to meet my exact needs. Overall, Canva AI performed well as a supportive tool. It simplified the process of creating visuals and ensured that my reflection was both informative and engaging. However, it required a balance between relying on its AI suggestions and personal customization to ensure relevance to the e-health themes. Would I use it again? Yes, I would use Canva AI for future projects. Its ability to quickly generate tailored visuals is a significant advantage, especially for presentations requiring a professional aesthetic. However, I would pair it with a more specialized tool for topics needing intricate customization or advanced data visualization.